Okay, this will be short. I just want to show you how to teach a patient how to use inhalers. And there's a couple of different kinds of inhalers. The first one and the most common is just one that looks like this. And it will come, this is what it comes in, like a little can. These are like under pressure. And you just, it'll come from the pharmacy. Let me see if I have an empty one in here. I'll show you. It comes in the pharmacy already like this, but and sometimes the replacement will be like this, and you just have your patient. There's like a little end here, and it fits right into the end there, like this. Okay. So then usually what you do is you have your patient shake it up, and this is probably Prevental. So this is only a bronchodilator, a fast-acting bronchodilator. There's several different kinds. Albuterol, Prevental, there's a bunch of different kinds. So you put the canister into, this is just a little plastic device like this, and you shake it up. And then what you do is you teach your patient, they're going to expel everything out of their lungs, and then they're going to put this in their mouth. They are going to push down on this while they're breathing in. They're going to hold their breath as long as they can, and then they're going to let it out. The reason you want to hold their breath is you want to allow this to work way down in the alveoli. So the action that you teach your patient is, and I don't have asthma, so I'm not actually going to use this, but I'll show you what this looks like. So you go, and you have them let it out slowly, like that. Now, this takes a little bit of work because you have to get all of these things together, and you see what happens when you push down. Now watch close. See that? It's just a little puff. And this is an aerosol inhaler. And that aerosol then would go in, and you want that to get down into your patient's lungs, and you hold it as long as you can, and then they slowly let it out. And usually an asthmatic, like if they've got sports-induced asthma or something, you just give maybe 1 or 2 puffs before they go work out. You know, if they've got an infection, maybe, you know, 1 puff, 2 to 3 hours as needed, something like that. So this is an inhaled aerosol inhaler. And a lot of people just, who have asthma will just carry this around. The problem with this is there's nothing on here to tell you how much you have left. You can kind of take this out and sort of shake it and hear how much, but you don't know. And so it might be a situation where somebody's really getting into trouble. They pull their inhaler out of their purse and they go to give themselves a little shot of this, and it's empty. So that's a little bit of a problem. So then what they've come up with are things, now this one is a little bit bigger, and this is Symbicort. And Symbicort, you can see on there, it'll say, like, it says right on there, like there's 60 like doses in here, but there's still not, I thought there was a thing on here, but I guess not. So Symbicort is a combination of, it's got a little bit of a bronchodilator and a little bit of a steroid. Now remember, your bronchodilator is going to go like this to your airways, and the steroid is going to reduce inflammation. So this is like a combination one, and it'll act the same thing. You teach your patient to do the exact same thing like I just showed you in the other one. Here's another kind. This is a disc inhaler, and this is an Advair. And this also has a combination of a bronchodilator and a steroid in it. The nice thing about that is, I don't know if you can see it, probably not. I'll bring some of these to class. Right here, right where my finger is, see that? I'll hold it up. You guys see that right there? It's probably super blurry now. But there's a little number there, and it will tell your patient how many doses that your patient has left. Now this one has powder in it, and the way that this kind of a disc works is your patient will load the disc, so they flip it over like this, and see, here's like a little mouthpiece like that, and then they load it up. You hear that click? Now there's powder in here, And they do it the same way that they do the aerosol, where they blow out, and then it's a little bit easier because you don't have to coordinate sucking in at the same time they're ingesting the aerosol. It's already loaded up, so you just put your mouth in there and suck it up like that. It's quite a bit easier. And then when they're done, they flip it over, and then see the number switches. So now they know how many they have left. So that's kind of a nice one with the powder and the disc. The other thing I wanted to point out, and I don't have one with me. I used to have one. And there's a picture of this in your book. And these are called meter dose, MDIs, a meter dose inhaler, because this one doses it out and is on a meter. This is a meter dose inhaler. The other thing that they can do is, there's a picture, I won't look for it right now. There's a picture in your book. You know how there's, that woman has an inhaler, and then there's like this plastic tube between her mouth and the inhaler? That is great for kids, because this whole process of breathe out, suck in, push down, hold it, is really hard for a little kid to get figured out. So they can put these things in there. They're called, the heck is it called? No, I can't remember. A spacer. It's called a spacer. So then the little kid or the person, if somebody has special needs and can't figure this out, they'll put the spacer in there, and then they put it in their mouth, and then they push down, just like I showed you before, and this then will go into the spacer, and then the person can just breathe. And you tell them to take deep breaths in and out, and all of this inhaled stuff just sits in there, so the person can get it into their lungs in a little bit easier way, if they can't do the whole suck in, suck out kind of thing. These powdered things don't work with that spacer. Because you have to actually suck it in, and but these kind can work with a spacer. And there's a couple different models. You'll see a couple different models, but the point is that it keeps that medicine in a chamber, and then the person can suck it in through the chamber instead of having to time it out exactly. So there you go. That's how you teach a patient to use an inhaler. Okay?